Babies are born, parents always worry the baby cries too much, and most pediatricians assure that a fussy breathing is very common. But sometimes the babies cry constantly, they're not satisfied, and they refer to a pediatrician, and he goes through a certain thing, and he talks about terms, and I bring up this term called colic. What is colic? Is it a real disease, or is it a made-up disease? What is colic?
Well, colic in a sense is a defined disease in which we say that the baby that has bouts of crying like 3 times a day for more than 30 minutes and baby being very uncomfortable, we qualify that as colic in absence of any other medical explanation for
It's
the
more
irritability
common
of the
seems to
baby.
be in first children and less common in second children and very uncommon in third children. So sometimes it might just be how parents react to the child.
So that proves that it's not always the best being first in anything in life.
But sometimes they get what we call the merry-go-round of formulas, because the parents keep calling, and some doctors change formula. Is that a smart thing to do?
Well, there are different reasons that a baby may be irritable or maybe fussy or maybe crying. Certainly, it's going to be very important to rule out an organic condition. Again, it's going to depend on the age of the baby. Commonly, we see these infants that are 2 months or 1 month of age that apparently, according to the narrative of the parents, cry very, very frequently and very intensively. A common condition that probably explains the irritability of the patient is gastroesophageal reflux. We assume that the presence of acid passing from the stomach into the esophagus, producing heartburn in the baby, produce discomfort and pain. These patients commonly present with regurgitation, spitting up, and they typically tend to arch the body and sometimes refuse the bottle, and the crying may occur at the time of the feedings or shortly after. So that's a common condition that may produce this fussiness of irritability on the baby. But certainly any other problem, a patient may have an infection somewhere, an upper infection, respiratory infection, that also may produce irritability. If the baby has problems passing the stools or passing gas because the baby is constipated, then certainly the patient may be also very uncomfortable, may maybe cry very frequently. And obviously there are other reasons. Sometimes if the irritability is accompanied, for example, by fever, by rash, by changes somehow in the behavior of the patient, problems in the central nervous system of the patient, like meningitis, for example, may be a cause of the irritability too.
When would you see a patient and say, we got to change the formula?
Well, again, we have commented about different possibilities explaining the irritabilities of babies. Allergies to protein present in the formulas may be also a cause of discomfort and irritability in patients, as well as sometimes diarrhea and sometimes the passage of small amounts of blood in the stools. So certainly if the patient is persistently irritable, we may try to change the formula. Most commonly, the formula is a cow's milk-derived formula. We may try a soy-containing formula, or sometimes using these products that we call protein hydrolysates, in which most commonly the protein from the cow's milk has been broken down by the manufacturer in a way that is going to be more easy to digest, and that the body is not going to recognize that as an allergenic, that's a condition that produces allergy, and then the babies, for the most part, tolerate those formulas very well.
But you would say going from infamil to Similac or some other cow's milk makes no difference, is that correct?
Well, certainly, yes. You're absolutely right. It doesn't make too much sense to just using different brand names for the same quality of protein. If it's the complete cow's milk protein, it really doesn't make too much sense to pass the patient from Enfamil, which is one of the commercial names from one of these common formulas, to Similac, which is another commercial name for a similar formula. But basically, those formulas contain the complete protein from the cow's milk.
But I read the label, that breast milk I read had this thing called whey protein and casein, hydroxylate, and Similac and Info have it. And then you see on TV ads all over the place for good stock on this whey protein. Is there any advantage of any of this protein mixtures and stuff?
Well, there are different type of proteins in cow's milk protein. So, in fact, yeah, there is this casein, and there is also whey protein. So there are components of
Any
the,
advantage
of the milk
mixtures
protein,
or separate?
or the milk protein. So, in general terms, these formulas try to be closer to the human milk, which is really the ideal product for the nutrition of babies. So the whey protein tends to produce a better emptying of the stomach, and then in that sense being digested a little bit more easily by the babies. But for the most part, there is not a significant difference. Now, there are formulas that have been partially hydrolyzed, or we call that, or partially broken down, and formulas like a Good Start. And really, for the most part, probably doesn't produce a significant difference compared to the other regular formulas. But in occasional cases, patients with certain degrees of allergies or intolerance may receive some benefit by changing to that mild hydrolysate formula.